Removal of skin lesion. To remove a lump on the skin such as the mole we see here, I start with skin antiseptic, with iodine antiseptic solution, from the center to the periphery in a circular motion. And then I place a tissue surgical field, which ensures the environment of the formation that we will remove. The incision that will be made in the skin is spindle-shaped. It follows the direction of the skin folds, and the ratio of the incision is 3:1 in length to width. The ratio is important for the surgical wound to contract later. Before proceeding with the removal of the formation, I must also do local anesthesia. The local anesthetic is usually xylocaine, which you put in a syringe. To give xylocaine to the patient, I must ensure that he does not have any allergy to the preparation. The simplest question is whether he has done any dental work in which local anesthetic was used, and then a thinner needle than the one with which I took the preparation from its packaging. I administer the anesthetic drug subcutaneously. I start from the corner. Insert the needle at a 45-degree angle. Aspiration to ensure the administered drug is not to be administered intravascularly, and gradual administration of the drug with parallel retraction of the needle. Then, on the other hand, again in the same way, suction and gradual administration of the drug by withdrawing the needle, in order to avoid multiple piercings of the patient's skin. In this way, the anesthesia that has been achieved concerns this and this length of the incision. This means that in order to cover the whole surface anesthetically, we will bite again from this point where the anesthetic has already been administered, and we will proceed in parallel, again with a 45-degree angle, suction and administration of the preparation with parallel withdrawal of the needle. In the same way on the other surface, the angle is always 45 degrees. The suction proceeds and the gradual administration of the formulation with parallel withdrawal of the needle. In this way we anesthetically cover the entire surface. During the actions of the anesthetic preparation, we place in the surgical field that we have created, the scalpel, the needle holder, the surgical forceps, and the scissors. Are necessary tools to proceed with the removal of the skin formation. We need gauze that is sterile, and we need stitches. The sutures stand out, in absorbable sutures, and non-absorbable sutures as you indicate on their packaging. These sutures are absorbed and have a triangular needle. This is the other feature of the suture as well as the curvature of the needle. While these sutures, despite having a round or non-traumatic needle as shown here, are non-absorbable sutures and their material is silk. Other stitches that I can generally use are the simple ligatures as it is in this formulation here. They do not have a needle, but they are just stitching that we use as ligatures. I then proceed to the exception of the formation. I will make the incision spindle-shaped as we said, starting with the tip of the scalpel in the corner of the surgical wound that will be created. While moving on, then the incision is made with the convex part of the scalpel and reaching the corner again, the incision completes again with the tip of the scalpel. The corresponding and on the opposite side, nose, belly of the scalpel and the incision complete again in the corner of the incision, with the nose of the scalpel. Then I can proceed with the surgical forceps and scissors, effectively detaching the surface, the formation I want to remove. The surface around the formation to be removed depends on the type of formation, its size and its macroscopic characteristics. If the characteristics of the formation are malignant, the removal of the tissue must be done to a greater extent, in order to ensure the exclusion of the formation in a healthy environment, in a healthy tissue. In this way, without having much contact of the forceps with the formation that I remove, the removal of the formation is done, which after being completely excluded will be sent for histological examination. The created surface must be closed.